It is now time for the Slocum Dickson Medical Moment. We do it every month here with Slocum Dickson Medical Group on Burstone Road. 798-1500, sdmg.com. And, of course, you can like them on Facebook as well. Adrian from Slocum, how are you?
Hi, I'm good. How are you?
Fantastic. It's
always nice to see her smiling face.
It really is.
You.
It really is because, she's always, just got this,
She always has a smile on her face.
A real nice
always.
demeanor. It's like a little, like a little ray of sunshine.
I love coming here.
I like that. Oh, we love that.
Yes, we do.
So, if you would please introduce who you brought with you today.
So today I brought with us Dr. James Cesare, and he's the director of our breast care center. And being that October is Breast Cancer Awareness Month, he's here to talk about some health tips for preventing breast cancer and detection and that sort of thing.
Absolutely, Dr. Cesare. Good morning. How are you?
Good morning.
Number one, and this is the reason why we do this with Slocum, because there's so many different facets of Slocum Dickson and people may or may not know. I am, my primary is at Slocum, and I wasn't really aware of the Breast Cancer Center. So talk to us about what is offered and how this thing kind of came about, and how people can get help with the Breast Care Center.
Yeah, well, we started at Slocum Dickson probably about almost 10 years ago, and our Breast Care Center is kind of nestled right in the first floor, the bottom floor of Slocum. And what we offer is a very comprehensive, full care facility where we have diagnostics with radiology, mammogram, ultrasound. We do breast MRIs as well. We see patients, we diagnose them, we biopsy them right on the same days if they have an abnormality on their mammogram or on their ultrasound. We get those answers back very quickly in 36 hours so that women aren't waiting and have this anxiety.
Well, that's one of the things that I really enjoy about Slocum is that you don't have to worry about getting the referral and getting the next appointment and having to wait weeks or whatever. A lot of times you can just kind of walk down the hall and get that that second opinion or that double triple check on stuff pretty much right there on the spot. We do
the mammograms right there, and if it's abnormal, they walk them right into the breast care center, and we take care of them right that same day.
Exactly, and that's my point. The fact that you have so much at your fingertips, and you don't have to get back into your car. And unfortunately, everyone knows at least one person. I personally, I lost count how many people that I know that have battled breast cancer or have family members that have battled breast cancer. Anytime that it's a possibility, very emotional. You just want to know, and a lot of times that fear of the unknown is really tough. So being able to walk in and get the testing and get that second get that definitive answer, yes or no, and then okay, if it's a yes, where from here, to be able to get that answer sooner rather than later. Really is a great peace of mind.
Right. Well, it's very scary. Anybody who has an abnormality, the first thing they think of is breast cancer.
Absolutely.
And they should. I mean, breast cancer is 1 in 8 women today.
God. The
good news is...
Oh, my God.
Yeah.
The good news is that breast cancer today is probably the only cancer that the death rate is going down. So we're doing good things.
Great.
We're finding cancers early. Early detection is really, really important. And it's treatable. It's no longer a death sentence to get breast cancer. So we're giving women a lot more hope and early diagnosis, early treatment, and women are right back doing what they usually do.
Now, obviously Breast Cancer Awareness Month and whatnot, and we're going to do Go Bald for the Boobies at the barbershop down at the New Hartford Shopping Center next week and whatnot.
Am I invited?
If you want to, it's $20 to shave your head. That's what we're doing. So if you want to, go ahead. If not, it's not like you're not doing enough for breast cancer patients. For crying out loud.
All right, I'll keep my hair.
And this may be a stupid question. If the big thing is, okay, get yourself checked out and whatever. And I know that a lot of women kind of do it themselves, and they can tell. If they feel something, can they just make an appointment and come to see you? Do they need a referral? How does that work? Because some people may, they may feel something and they may dismiss it because, it's nothing and, blah, 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 and just go on their day. But number one, they should definitely get it checked. And number two, to get into see you, what's the best process to kind of do that?
Well, at our breast care center, we do not require you to have a referral. So you can call up and make an appointment.
That really is. I'm sorry. That really is. That's great.
Really, our policy here is that if you feel a lump, you're coming in right away. We don't make you wait 2 weeks, 3 weeks, a month to get an appointment.
That is amazing.
We are busy, but, having a newly found breast lump is priority.
Absolutely.
Wow.
We're talking to Dr. Cesare. He's the director of the Breast Care Center at Slocum Dickson Medical Group. It is the Slocum Dickson Medical Moment here on KISS FM. It is Breast Cancer Awareness Month. For details, you can go to sdmg.com. Of course, they're located on Burstone Road, 798-1500 as well. Now, as far as detection and okay, unfortunately, like you said, 1 in 8 women have breast cancer. That's the statistic. You go through the process, you find out, yes, unfortunately, you do. Now what? And I think that's the one of the most important questions once you get there. Now what? What's the game plan? And how does Slocum kind of work into that?
Yeah. Well, treatment has evolved today, so all breast cancer does not require you to lose your breast. You do not have to have a mastectomy. Matter of fact, we actually really promote more breast-conserving surgery because we've found over the years, through doing this over 50 years, that actually less is just as good as doing more as far as breast cancer surgery. So right at our center, if you came in and had a diagnosis, I made a diagnosis of breast cancer, I would create a team around you. So I would bring in one of our surgeons, one of our medical oncologists, our radiation oncologist, and we treat you as a team. And we get you appointments right away. Everybody partakes. I direct your care, and then we get you right through this process, right back to, being cancer-free.
And Adrian, I know that, it's rough not only on the patient but also the families and whatnot. I know you guys offer like support groups and things of that nature. People who, because you kind of feel like you're on a stranded island at points with something like this. People who, there's only certain things that people who have gone through it or are going through it would understand. Your friends want to be there for you, but unless you've been there, done that, you really don't get it. And I think that's where the support group really helps.
Right. And, the Breast Care Center is focused on really providing complete care for the patient, and the support group is part of that. Actually, there's one tonight, and it's every other month right there at the Breast Care Center, and it's open to patients, non-patients, relatives, family members.
And it's interesting, at the support group, believe it or not, even though I am there, I hardly do any talking. The patients talk to themselves. They explain, they talk about their journey, their problems, their troubles, their successes, how they get through everything. And when we bring new patients to the support group, or when they do come, if everybody's invited, they actually feel better when they leave. They know that they're looking at another woman and saying, listen, you've already gone through this journey, and look at you. You're doing great. And it gives them a lot of hope.
Well, just like we were talking before, it's a lot of it is fear of the unknown, and being able to actually have that conversation and see someone who was them 2 years ago, 3 years ago, and be able to have that conversation and kind of compare notes and whatnot. I think that's mentally, that's got to be, mentally you have to be ready as well as physically. Is that fair to say?
Yeah, I think it really is. It's a lot of mindset. If you start very negative, that you're not going to do well, it's harder. If you start with, well, let me get through this. I'm listening to everybody. I'm taking everybody's advice. I'm taking the doctor's advice. We're going to beat this, and they do, And
the main key is, if you feel something, come in and get it checked. Because early detection is the best thing.
Absolutely.
Yeah. Yep.
And there's information on our website, too, just to let everybody know if they want to find out about the Breast Care Center, about the support group. It's all on sdmg.com if they're interested in that.
It is sdmg.com. Of course, you can like their Facebook page as well. Slocum Dickson Medical Moment, courtesy of Slocum Dickson Medical Group, located on Burstone Road, 798-1500. Adrian, thank you so much. Dr. Cesare, Director of the Breast Care Center, thank you so much for the time. I know, especially in October, it's, you're all over the place and whatnot.
We're a little busy.
A little busy. But you know, I'm really glad that you came in, and I'm really glad that we were able to kind of share this because you know people feel something, and you don't want to not do anything with it. You want to go get it checked. You don't need a referral. You know, just go in, get it checked. Better to have peace of mind than pass it off.
Absolutely.
So,
Thank you for inviting me.
So thank you so much. We definitely appreciate
Yes,
it. We're going to
thank
break,
you.
come back. Big Papa Ben on KISS FM.